After a trip to the hospital, you may be prescribed medication. It's meant to make you better, and it does, usually. But sometimes mistakes are made, and the medication that is supposed to help instead causes some problems. These kinds of mistakes are called medication errors. Medication errors are a huge problem. In the United States alone, 1.3 million people are injured each year due to medication errors. And medication errors are usually underreported, meaning this is on the low side. Around the world, the estimated annual cost of medication errors is $42 billion, and an average of one person a day dies from medication errors. Health organizations are aware of the problem and have made recommendations on how to do better. One of the more effective strategies is called medication reconciliation, or MedRec. MedRec is a process that involves several steps. Step 1, collect as much information on the medications that you, the patient, have been taking as possible, preferably from at least 2 sources. Step 2, compare and correct the medication list to create a best possible medication history. Step 3, compare any newly prescribed medications to the best possible medication history to look for discrepancies. And Step 4, at discharge, generate a reconciled medication list to give to you and your caregivers. These steps should be done when you are admitted to the hospital and continued throughout your stay there. But MedRec takes time and resources to complete properly, and it is prone to a few kinds of issues. Because it isn't the easiest thing to do, it is hard to manage the changes that come with starting it in your hospital. Also, not all hospitals have the resources needed to do a proper MedRec. Finally, trying to remember all the medications you are taking is hard, and if it is an emergency, you may not even have the ability to tell the physicians anything. Computer applications, such as electronic medical records, or EMRs, are making it easier by doing automatic comparisons of medication lists and new medicines, and providing easy discharge reports. Also, there are many apps that help patients keep track of their medication list. However, most of them don't provide an easy way to get this information from your phone to your physician. Our proposed solution would fill this gap and get your physicians the information they need. So how do we do that? Well, creating another mobile app wouldn't really help. There are so many out there that you probably would never even hear about us. Instead, let's help the apps that you already use. How do we do that? We create a database to store all the important information you have been saving about your medication list. It will store what your medications are, how often you are supposed to take them, and even how often you actually do take them, if your app supports that. But wait, how does the database get information from the apps? We will create a standardized, easy-to-use application programming interface that any app can connect with to send their information to our database. And what about your physician? How do they get access to the data? We would like to connect to all their EMRs and send the information to them immediately, but there are so many EMRs out there and they do things so differently that it would take forever to connect with them all. So, while we are working on that, we will make your information available to them through clinical viewers. A good example of these systems is Clinical Connect, which many physicians already use. It's not an ideal solution though, because viewers are just that, ways of seeing information. Our original plan, connecting with the physician's electronic medical records, takes that one step further by adding your data directly into their computers. No need for the physician to do anything other than look it over. Doing this on our own would be difficult, and it would take forever to get even most people to hear about us. So we will look to build partnerships with governments and integrate our database into their infrastructure. This would make sure that we are meeting all the safety and privacy guidelines required by the governments. It would give developers a reason to connect to our system, and it would give our system the publicity it needs to gain traction. Of course, there are going to be some difficulties along the way. Our solution depends on integrating with Clinical Connect to get started. This means we will probably have to make a proof of concept to show them why they should care about us. Also, with so many mobile applications to connect to, there will be a lot of standardizing to do, which is why we are going to use HL7 or FHIR for all messages. We also have to worry about privacy and security. Being in the cloud means we are more vulnerable than local databases, and allowing other people to send us information means we will need to check out each app to make sure it meets our high safety and quality standards. Finally, some people may just not want to use our platform. It will take time and some education to show them just how effective and useful our system will be. We know that there will be some ethical issues to consider. Privacy and security have come up before, but they could quickly turn into ethical issues if not handled properly. Also, you may not be too fond of us tracking your medication use. To help with this, we may need to generalize the information into broad statements like, "You took all your medications," or else just restrict who can see your information until you say it is okay. Once we handle those issues, though, our system is well suited to solving the difficulties of MedRec. Allowing you to track and remember your medication list and then send that information easily and securely to your physicians will simplify one of the most difficult and unreliable parts of the MedRec process, collecting information about what you actually took. Not only will this give the physician more accurate information, it will also help you be more involved in your medication process, meaning when your physicians ask how you are doing, you can give them good, accurate responses. Together, you and your physicians will improve the MedRec process, making it easier and more effective. This will mean less medication errors and a safer time at the hospital.